Welcome to the Mira Aesthetic Medical Center. Let's talk about liposuction, or as Dr. Mirrafati calls it, liposculpturing, because that's what liposuction is, the sculpting of one's body. It truly is phenomenal how liposuction changes people's perspective of themselves. When you see Dr. Mirrafati's before and after pictures of patients and listen to their testimonials, you'll be amazed at how incredibly skilled he is at performing this art. I did say art. Dr. Mirrafati is revered by patients and colleagues as a master of body sculpture for many reasons. He utilizes the vibrotumescent form of liposuction, which he perfected himself to sculpt his patient's body into a proportionate, leaner, pleasing image. This state-of-the-art technique makes bulging fat deposits easier to reduce and leaves the patient with less bruising, discomfort, and recovery time. In some patients, it will reduce the visual appearance of cellulite. Liposuction, performed by the skillful hands of a qualified physician, is a safe procedure with a fast recovery period. Most patients return to normal activities in just a few days. Then, for many patients, this is the first time they're able to look in the mirror and not be unhappily drawn to their once disproportionate hips or thighs. You're not alone if after long and well-fought battles with diet and exercise, you still find yourself disproportionate in the thighs, have love handles around your waist, or too much booze in your caboose. When this is the case, normally there isn't much that can be done except to liposculpture that area. Liposuction is not a substitute for permanent weight loss, but it can be a great beginning to a new you. I can't begin to tell you how important it is to choose a surgeon that is gifted in performing the liposuction procedure, and one who enjoys what he does and has the eye to sculpt your body into a proportionate, harmonious, shapelier result. Here's Dr. Mirrafati to explain the technical aspects of this surgical procedure.
Hi, my name is Dr. Mirrafati, and I'd like to thank you for coming to our clinic. I hope this video will help you make an informative decision about your liposuction procedure. I often say liposuction is not a solution to weight loss, but it's a very good beginning. It is great for those with body dysmorphic figure. People who are disproportionate, they have fatty deposits in their lateral thighs or inner thighs, or a love handle that is proportionate to the rest of their figure, what we call the violent deformity. Liposuction is an artistic procedure, and it is important that a surgeon have an artistic eye to sculpt the body in a harmonious and proportionate figure. This picture highlights the different area of liposuction that can be done in a female and a man. When we're talking about liposuctioning or liposculpting procedure, I often tell patients that it's best not to scatter the area that they choose to do. For example, if they're doing the lower abdomen, they must also look at upper abdomen as well as flank and the hip area to complete the result. Or if they're doing an outer thigh, they should also look at inner thighs and anterior thighs as well. At the end of this video, we will come in and we'll determine the areas that will fit you the best. The procedure that I do is called vibrotumescent technique. This is where we inject the fluid in the area that we're going to do liposuctioning or liposculpting. And then we vibrate the area in order to distribute the tumescent fluid evenly throughout the area. With vibrotumescent technique, the patient will have minimal blood loss, which means minimal bruising and a faster recovery. Another good point that I always tell patients is that in our clinic, I use a small size cannula, and also the pressure that I use is medium to low pressure. It is very important not to use big cannula or high pressure when you are doing liposculpturing, because it will cause a dent and an undesirable result. Another important aspect of liposuction is the garment that need to be worn post-operatively for 4 to 6 weeks. The garment is very important. I often say that liposuction is a sculpting job, and I can do the best sculpting of your body, but the garment you wear is my mold to keep your body in the shape that has been sculpted. I hope this video has been informative and answered some of your questions about the liposuctioning or liposculpting procedure. We will come in and go over some of the risk and complication with you, and we will go over some of the more detailed aspect of the surgery. I thank you for your attention.
When I came in here, I was about a size 8. And so now I'm about a 2 or a 0. The liposuction was great. I tried, I dieted on my own for a long time, but I had those certain problem areas that just, the fat wasn't coming off of me at. And so with the liposuction, I was really able to get a more sculpted contoured look that I wanted. I'm really happy with it. Everything was explained thoroughly. I knew what I was getting into when I went into the surgery, and there were no surprises at all.
Just fitting in clothes, you know, it just never seemed to work right. Either my waist was too small and didn't fit across my hips, so it's just something I've wanted to do ever since I was a kid. The liposuction I had done has made a big difference. I think not so much overall in my weight, but just in clothes, just fitting in jeans, fitting in slacks and skirts, and for business I'm a lot more comfortable now that I had it done. And you know, you think that you're going to be it's going to take you down to really thin size, but no, what it does is just sculptures your body, and that's what I really like about my liposuction. My recovery was very fast. I think I was back working out at the gym probably within a week.
The results of liposuction was awesome. I noticed immediate results. I didn't have any swelling. After the surgery, my size went down from like a 5 to a 3. My clothes fit better. The saddlebags are gone. I feel better.
The liposuction was beautiful. The sculpture was beautiful. Very happy with the work.
The liposuction was on my thighs, and it was the same thing. I had that done on a Monday, and I think I went back to work on a Wednesday. So I was only a day out of work, but the pain was minimal and the results were great. The procedures were explained very well. In fact, even more than what I expected. I mean, they actually prepare you for worse than what it really is. So yeah, it was very well explained.
I hope you found this presentation informative and have a clear knowledge of the treatment. Thank you very much for watching.